Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio, where we provide actionable health information on a week-to-week basis that can help you improve your life. Feel free, head over to justinhealth.com, where we have various opt-in video series on more in-depth health topics such as female hormones, thyroid, and gut health. Also, while you're there, feel free and schedule a consult with myself, Dr. J, and or my colleagues. We're available worldwide to provide natural health support for any of your major health issues. Again, welcome to the podcast and enjoy the show. Hey guys, it's Dr. Justin Marchegiani here. Really happy to be back. We got a fabulous podcast on deck for you today. We'll be chatting about the correlation and potential causation between low vitamin D and COVID-19/coronavirus infection and symptoms. Evan, how are we doing today, man? Mm-hmm. Let me set the table for everyone here first, okay? So most of the mainstream kind of conventional approaches to what's going on with coronavirus are very defensive measures, right? Washing your hands, wearing a mask, okay, right? Maybe some social distancing, maybe quarantine. These are all kind of common sense, defensive measures that are put in place. There aren't really a lot of offensive measures, right? So we want to take the time today and just look at some of the things that are in the literature now, that there's some evidence out. Maybe it's correlation, maybe it's causation. Again, to actually have causation, you need a lot of money and studies, so that probably will never happen. But we can use knowledge guided by experience to extrapolate the correlation and apply it and see how it works from an N=1 standpoint, apply it in your life. So we're excited to talk about that. Some of the things that we're lining up here are in regards to vitamin D and vitamin C and some of the data on that. And the mechanism really is, we know inflammation is being caused, especially in the lungs, by these infections. We know an increase in cytokines can also be produced. Cytokines are these inflammatory chemical messengers that happen as a result of your immune system and or the inflammation caused by the virus. And so what happens is your body needs things to kind of help quench the inflammation. So there are antioxidants, we call them redox components, right? Vitamin C is in that pathway, so is glutathione. They really help quench and they help give off electrons to deal with and neutralize inflammation. And then there are also nutrients like vitamin D that are immunomodulators. They modulate the immune system, and by modulating the immune system, we can have a better, more intelligent immune response, less maybe internal cytokine production. We can also make natural antimicrobial peptides like cathelicidin and others that can really help knock down even the infection as well, because vitamin D helps modulate that Th1, Th2 immune response. So if we have a healthier immune response, it's theoretically we can go after and deal with the infection. We know the infection rates are, I went over the data last week, a lot of anecdotal, I shouldn't even say anecdotal, but a lot of the early antibody testing, for instance, Triumph Food Plant here up in Kansas City, I saw 353 workers tested positive for coronavirus. All 100% of them had no symptoms. They did a 3,300 patient study for the jails, for the federal jails. 3,600 patients had coronavirus. They tested them antibody-wise. 96% had no symptoms. All right, they did a study up in Santa Barbara or LA area, and they did a study up in Stanford/Santa Clara area. 50 times plus the amount of people that had the infection actually had antibodies. So we know this is not a hallmark of let's say, a very virulent infection. And Evan will go over the data. Looking at the ages, we see a lot of people that are younger really not really coming down with it. So that's important to know. And the CDC even said from age 0 to 17, the flu is actually far more severe than the coronavirus on our young people. Evan, go ahead. Well, I'll just say we need about 60% to get really this herd immunity level where it's hard to pass it around. Like if every other person has antibodies for it, it becomes very difficult to pass it around. So over time, most people will get it, right? You can't, unless you're going to totally be in quarantine forever, which I think actually negatively impacts your immune system. It may make you more susceptible to having more symptoms and succumbing of the virus. I think even if you're older and you're have comorbidities, you should still be outside and having reasonable social distancing. Remember, the virus can't live more than a minute in 75-degree temperature, 40% humidity, only a couple of minutes, because we know UVC light kills the virus. We know that. It's a natural disinfectant. So if you are older and you have those comorbidities, you should be outside getting fresh air. You should be getting vitamin D, and still keep your distance if you're concerned, but you should still be outside. Staying inside is not healthy. They did a study up in New York City, and they found 60% of people that came in with the infection actually had quarantined. So the quarantine thing is not what it is playing out to be. I think there's more risk factors in that and how it impacts your immune system just staying inside too long. Well, I think moving is a big thing. I think getting fresh air, I think getting vitamin D and sunlight, I think just being outside does something. We talk about it with, you mentioned it in the past with forest bathing, how it impacts cortisol levels and helps your immune system. I forget, what's the term for forest bathing? Yeah, yeah, exactly. Well, I'm not sure if you caught it over the weekend. Dr. Burks said she was commenting about the head of the CDC. She said that there could be up to 25% incorrect on the CDC data points on the COVID-19 death/diagnosis. So she commented that over the weekend, which is interesting. I want to share some data here on screen just to kind of bolster the things that you're saying. So if you guys are listening to this, you can always jump on the YouTube link as well to get some more information. So here's the study that Evan was showing here. looking at corona case fatality rates by age. So you can see here 0 to 9, 10 to 19, 20 to 29. So, I mean, you're looking at very minuscule percentage points here, right? Very minuscule percentage points. 30 to 39. And then it starts really going up significantly once you get into 60 to 79. But even that, I mean, really 70 and 80 is where it really goes up. You still only have a chance, a 1 to 2% chance in the 60 to 69, right? Now, so here are the coronavirus deaths from last week, okay? So how it works is this. You have the top number is the deaths, the bottom number is the case. So you divide the top number by the bottom number, and then you get a percentage, okay? That's how you figure out a mortality rate. So when Evan talks about this data here, is if there are more cases than we know about, right, that makes the denominator, the bottom number, bigger, right? And what we're finding is the cases are actually getting far more bigger because of the fact the asymptomatics. The data is showing a 50x asymptomatic being present. Looking at the Stanford study, they showed data there. And up at the study up in Chelsea, Mass. and Boston, study down at in the UCLA area, USC did a study. So there's about 3 to 5 different studies on this already out there. I did a video on this last Friday on my YouTube channel. We'll put that video in the description so you can go dive into that. So the data is there. Now, we do know here, this came from Italy, right here, this study here. It only bolsters what we talked about. So you can see it came from a government agency, Istituto Superiore di Santi. Even though my last name is Marchegiani, I don't really speak the best Italian, so you'll have to translate that. Yeah, I got to brush up on my Italian, right? But in general, you can see number one, it primarily came in 2 major areas here, right? About 69% came in 2 major areas. There's a reason why those 2 areas were hit really hard. I can go into it briefly, but Lombardia is a big area where there's a lot of textiles produced there. So a lot of Italian textiles are produced, right? China bought a lot of companies, Italian clothing companies, brand companies, and instead of making it in China, they wanted to keep the made in Italy type of logo and branding on there. So they fly a lot of Chinese up here to these areas to work on the products in the textile industry in the mills. So part of the reason why these areas were hit so hard is there was a flow of Chinese up here to go work in the textiles. So that's a big reason why, not to mention there's just a lot of elderly population up there. Now, let's look at the data. So if you go down a little bit lower, you can see the average age is a little bit over 80, about 80, 81-ish. And then when you look at the people that actually died, I mean, look, you don't really have an increase until you get in the 60s. I mean, look at that. So this is the deaths here, and you can see men are actually being hit. About 2/3 are men, 1/3 are women. You don't have an increase in women until you get to 90 plus. That's probably because most of the men are already dead by then. So you can see that spread right there. And then look at the diagnosis, right? So this is interesting because they break down what percent of people had what disease that died of COVID. Now, when you go down to the bottom, a number of comorbidities, look at this, 3 or more comorbidities, 61%. That is unbelievable. So what's being portrayed on the media is that this is an infection that could just take anyone down, right? No matter what. No, that's not the case, not even close. The data does not support that. Now, when we actually put reason, logic, and evidence here, there's a lot less fear guiding people. This is a disease that's going to take primarily elderly people down, people that have multiple comorbidities. Now, is it possible that you're going to see a news article with someone who's 20 or 29 passing. Yeah, I mean 0.2% in China, 0.22% in Spain, 0 in Italy, right? Once you hit 30 to 39, then you had 0.3%. Is it possible someone from this age category could die? Yeah, it's very possible. You don't know what their comorbidity status is. There's HIPAA laws in the United States, so you're not going to see reporters saying, hey, this person was a type 2 diabetic. Hey, this person eats processed food. Hey, this person, whatever. You're not going to get that data. So it's easy for people to be like, oh, I'm so scared. It's attacking people that are in their 30s. You just don't know about that person. And obviously, you don't even know if the picture they're putting up on the screen is even in the last couple of years or the most relevant decade. A lot of times they're notorious for showing younger pictures of people that have passed. That's pretty common. So I just want to lay out the data and just look at what the statistical norms are for this infection so people can get a perspective. And then part of the correlation and why it's older people is, number one, you've had more time to accumulate a disease because bad habits compounded over time is what creates diseases, right? And then also certain nutrients like vitamin C and vitamin D go down over age. And we'll look at the data in a second on that. Evan, do you want me to highlight any of these here at all? And this is less than the flu already, by the way. So the numbers are, just so you understand, hysteria math is not understanding the full breadth of the case, okay? So not understanding the full population, the extent to which people are affected across the board, because the asymptomatics prevent people from being tested that have no symptoms, right? You're not going to go to the hospital and get tested here. Go ahead. Yes. Yep. I'll pull that article up here in a second, but that is what is showing here as well. The hysteria math may even be cut down more. And there's two different diagnostic codes. I've already talked about it in the past, but the hysteria math, the diagnostic codes are U07.1, U07.2. Let me pull this up here as we chat. This will hopefully help you guys out to give you a little bit more info here. I'm going to help you guys out on this, okay? Correct. Correct. And then here's an article by Washington Post right here. So during the task force meeting Wednesday, heated discussion broke out between Deborah Birx and the physician administration and Robert Redfield. He's the director of the CDC. Birx and others were frustrated with the CDC's antiquated system of tracking virus data, which they worried was inflating some statistics such as mortality rate and case counts by as much as 25%, according to 4 people present for the discussion. 2 senior administration officials said the discussion was not heated. So we have this 25% number that is interestingly popping up. So I wanted to highlight that. And then here's some of the data here briefly. I wanted to highlight more than 370 workers at pork plant in Missouri tested positive, right? We go down here and look at the data. What do they say? All of them were asymptomatic. All were asymptomatic, okay? We go here and look at the, in 4 U.S. state prisons, nearly 3,300 inmates tested positive coronavirus, 96% without symptoms, okay? Now, let me just be clear. Asymptomatic means you develop an immune response, you develop antibodies, you are infectious for 2 weeks or so on average. The infection is no longer shedding after about 2 weeks on average. You have antibodies, and now more than likely you won't be able to get sick for years. Now we go to the USC study, similar thing here. USC study, they found that the estimate 28 to 55 times higher in the antibodies versus the confirmed cases, okay? We have a study here, Science Magazine. Similar type of category here on this thing here. This, I think, is looking at Germany, though. I think this is up in Europe. And the same thing, I had it highlighted here earlier. I'll have to come back to this one. I had it here. Exactly. Yep, exactly. There's an actual number down here. I had it highlighted earlier, but see here, 99% false positive, into controls. There it is. There it is, right there. That's more than 50 times as many viral gene tests had confirmed and implies a low fatality rate. So 50 times the amount of viral, meaning there were 50 times more people that had the antibodies than the viral gene test had confirmed. That's what I'm saying there. So 50 times more people had antibodies, which showed previous infection that were actually testing positive for the infection. And then the Guardian right here, coronavirus antibody study in the California, right here in the county here at the high end was 85 times. Okay, 85 times right there. So I have all my... For every one person that tests positive with this PCR DNA swab, they take the little swab, they put it to the back of your nose and hit the back of your throat, you test positive, right? So when I say 50 times, that means there are 50 other people that never had the infection symptomatically that are testing serologically positive for it, meaning they have an immune response showing that they got exposed to the infection. Does that make sense? No, that means that this virus is not as virulent as we thought it is. It maybe so contagious is meaning it's easy to spread, right? I think the virus is very contagious. It's easiness to spread. That's the R naught number, right? The virulence is how strong the infection is, right? So you have like a virus like Ebola, it kills 40% of people that it comes in contact with. That's strong virulence. Ebola, not that contagious. I think it only spread to a couple of thousand people. So usually in kind of virus world, there tends to be a correlation with the more virulent the virus is, the stronger and the more chance it can kill you, usually the less contagious it is. Now, you have the Spanish flu of 1918, right? Why was that a big deal? Well, we didn't have antibiotics, right? So there's a lot of post-viral secondary pneumonia that happens, and if you don't have antibiotics, then a lot of times it's the pneumonia that kills you. Not to mention we had a second wave in 1918 because of people coming back, soldiers coming back from World War I in Germany that re-brought back the infection. Not to mention, I don't think we really had a lot of the good sterile things like we didn't really have a lot of the hygiene things kind of fully dialed in back then either. And I know there were big, huge changes when they started doing hospitals outside and getting more vitamin D. That also made a huge game change there as well. Exactly. Exactly. I wanted to put a couple of studies that came out recently out there. Vitamin D supplementation could possibly improve clinical outcomes of patients infected with coronavirus. Now, these are observational studies, okay? Meaning they didn't do a clinical control. They didn't do someone in a metabolic ward, gave them a virus, and then gave them vitamin D and did the same thing to another group and gave them the virus and no vitamin D and randomized it. That's like the double-blind placebo-controlled study. That's not this. This is observational. And there's always the healthy user bias, right? What's the healthy user bias? The healthy user bias is people that take care of themselves and do the right thing and drink good water and get some sleep and move may also have good vitamin D, right? So then people that have good vitamin D, they may be doing a lot of other things right that keep them healthy. And so we may be seeing that in here. So it's always possible. But in the study, I'll just put it up here, and people always ask, like, what's the link? What's the link? Right here. This is the link, okay? That's the link right there. We'll try to put the links in below the video as well. But let's look at the study. Let me just go right down to the conclusion. The results suggest that an increase in serum 25-hydroxy vitamin D level in the body could either improve clinical outcome or mitigate the severe critical outcomes, while a decrease in the serum 25-hydroxy vitamin D level could worsen clinical outcomes. In conclusion, this study provides substantial information to clinicians and health policymakers. Vitamin D supplementation could possibly improve clinical outcomes of patients infected with COVID-19. Further research should conduct randomized controlled trials and larger population studies to evaluate recommendations. That's, I think, very powerful right there. Go ahead. Yeah, and basically the cutoff was vitamin D status below 30 nanograms per ml was associated with more severe disease and mortality in the Southeast Asian study, okay? And then in general, one study gave adequate stats was 31.2. So basically, when you went above 30 or 35, things definitely improve. So levels above 34 is associated with an improvement. So that was kind of the general gist. So that's just kind of highlighting that there. And then if we go here to this study, vitamin D level of mild and severe in elderly cases, they found here most male and female subjects had 25 hydroxy vitamin D levels below 30. Also, most of the subjects with pre-existing conditions had 25 hydroxy vitamin D level below 30. So now the question here is, well, is it because they're sick and unhealthy? Now they have a harder time getting outside and getting vitamin D. So maybe the diseases are also causing them to have lower vitamin D. And then the diseases themselves make them more susceptible to the infection. So these are always, I'm just talking about like confounding variables, things that could be affecting the situation that we're not really factoring. So I'm just kind of spitballing, off the cuff with you guys. Majority of subjects classified as severe 25 hydroxy vitamin D levels were below 30. 25 hydroxy vitamin D levels were negatively related, although clinical trials could provide more meaningful findings as the causation of 25 hydroxy D levels and COVID-19 severity. Basic healthy solutions such as vitamin D supplementation could be raised even in community levels, and awareness of vitamin D benefits in fighting infections such as COVID-19 should be disseminated, especially in the vulnerable elderly population. So they found it important enough that we should be raising the awareness of vitamin D in our elderly population. I thought that was very, very important and powerful. You want to comment there? Correct. Correct. Well, actually, with vitamin K, though, vitamin K may actually increase the clotting. So we may want to be a little bit careful on the vitamin K. Some of the over-the-counter naproxen is showing to be a little bit beneficial. Maybe a little bit of white willow bark aspirin, baby aspirin, or maybe some natural white willow bark could be helpful, or some higher dose like nattokinase enzymes. So maybe the systemic enzymes could also be very, very helpful in kind of thinning things out. So be careful with the vitamin K. Now, if you're getting it from food, from green vegetables or ghee or butter, you're probably okay. Just wanted to highlight that. Anything else you want to say, Evan? It inhibits the vitamin K. It's going to mess it up. Now, again, like I would never say don't eat your green vegetables or don't eat your ghee, because I think that there's enough nutrition and antioxidants in those compounds. Like in this study, we'll talk about it. They talk about sulforaphane actually helping with a lot of the cytokines and the inflammation. Well, guess what? That's what the infection's causing. So we wouldn't ever want to decrease the nutrients. I just think you want to hold those nutrients stable and let your doctor, know about that if they're going to be adding a blood thinner in there. It's really only going to matter if you're doing something on the more like vitamin K inhibition side, right? There are other ways to thin out bloods besides that. Hey, okay, let's take a look at it. Let me get it on screen. Let me get it on screen here for everyone to see. So this is it here, New York Post, treating with vitamin C. Vitamin C administered in addition, such as anti-malaria drug, that's the hydroxychloroquine, and the antibiotics of myosin, versus in various biologics and blood thinners. Yeah, makes sense. Let me show a. Yeah. Yep. Really interesting. Let me kind of dovetail on that. So this is a study actually out of China. Medical Drug and Discovery. This is early March. Can early and high intravenous vitamin C prevent and treat coronavirus? So this is interesting. So they're talking about the acute respiratory distress syndrome, and they're talking about early uses of large doses of antioxidants, and they abbreviate it as VC, vitamin C, may be an effective treatment for these patients. Clinical studies also show that high doses of oral vitamin C provide certain protection against viral infection, which is great. Neither of these things have side effects, which is awesome. I mean, if you go too high on the oral vitamin C, you could get loose stool. You may bypass that if you're doing intravenous. They talk about coronavirus and influenza are among the pandemic viruses that can cause lethal lung injuries, right? The acute respiratory distress syndrome, ARDS. Viral infections could evoke cytokine storm that leads to the lung capillary and endothelial activation, neutrophil infiltration, that's the white blood cells getting in there, and lots of oxidative stress, right? Which create reactive oxygen and nitrogen species. What's oxidation, everyone? That's a loss of electron. Like when you're in doctorate school, right? You remember the saying oil rig, okay? Oxidation is a loss of an electron and reduction is a gain of electrons. So if someone talks about oxidation, they're talking about losing electrons. And guess what? We have antioxidants. What's an antioxidant? It's an anti-loss of electron compound. So basically, they're donating electrons. They're donating electrons when electrons are lost. That's what vitamin C is doing. And so it talks about is usually accompanied by uncontrolled inflammation, oxidative injury, and damage to the alveolar capillary barrier. So what happens is with the capillaries, there's what's called Boyle's law, where there's gases exchange, right? Deoxygenated gases or deoxygenated blood is being exchanged with oxygenated blood, and then it goes back up to the left atrium, back to the left ventricle, and then that oxygenated blood goes. But if there's inflammation and damage to the capillaries and the alveoli in the lungs, you're not going to be able to exchange oxygen. That's why you're seeing this oxygen drop. So increased oxidative stress is a major insult in pulmonary injury. and it manifests with substantial high mortality and morbidity. Now, this is interesting. They talk about in a case report, 29 patients with COVID-19 pneumonia showed an increase in C-reactive protein. That's a marker of inflammation. It's a marker of oxidative stress. And they talk about that activation of the NRF2 signaling plays an essential role in preventing cell injury from oxidative stress. So NRF is like this anti-aging pathway people try to increase with magnesium. They increase it with curcumin. They increase it with bioflavonoids like resveratrol. They increase it with compounds like milk thistle, which help actually decrease a lot of this oxidation. All right, I'll pause right there, Evan, so you can comment. Go ahead. Correct. Yep. Correct. Yep. 100%. I think what you said, and I'm putting all the studies up on screen because I know what we're saying may be a little bit controversial in case people are watching a lot of mainstream news. They may be like, well, why the heck haven't we have heard about this stuff? Well, frankly, it's because certain governmental agencies, they're going to, toe the party line, and food and supplements and natural compounds really isn't part of that, which is kind of sad. As this study over here showed, they mentioned that vitamin D should be disseminated, especially to the vulnerable population, meaning that information should be disseminated. Research is saying it, so it's not me saying it. Of course, that's kind of where my bias lies, because I think vitamins, especially essential nutrients your body can't make, of course, should be at adequate levels. Let me go back to this study here. So the oxygenation index improved in real time, so people were actually getting better oxygen exchange. They were cured and were discharged. In fact, high-dose vitamin C has been clinically used for several decades in recent NIH expert panel. And again, I'm not saying, by the way, right, I'm not saying people were cured. I'm saying the study said that. So that's not me speaking that, right? We don't ever cure a disease, right? Of course, only a drug can cure a disease, right? That's my legal disclaimer there. All right, because of the development of the efficacious of vaccines, antiviral drugs, because of the development in these drugs, how they take more time to occur, right? 18 months for a vaccine. Vitamin C and other antioxidants are among currently available agents to mitigate COVID-19 and then the acute respiratory disease syndrome. Given the facts of the high-dose vitamin C is safe, healthcare professionals should take a close look at this opportunity. Obviously, well-designed clinical studies need to be developed so you can create the right protocols. But in general, there's good data for this. And I think this is a first-line thing that I've been saying from day one. We look at the nutrients we need to support our immune system. What are the foundational ones? Vitamin A, cod liver oil, vitamin C, your leafy green vegetables, and some of your low-sugar fruit, but also get it supplementally so it's more therapeutic. Vitamin D, sunlight, some places, mostly supplementation to get at that higher level, right? My goal is about 50 ng per ml on the vitamin D. So I think a good standard recommendation is 5,000 IUs for every person. I think that's pretty decently standard. You could go 10,000 if you're lower and you need more of a bump. And if you're uncertain, get tested if you can. But if you don't want to leave the home, at least 5,000 is a good starting point as well. And then so vitamin A, vitamin C, vitamin D, and then we could do something like glutathione or an N-acetylcysteine precursor, which have been shown to help with the oxidative stress, and they also help decrease viral replication. Not necessarily shown with COVID, but it's shown with other viruses to decrease replication. So that's kind of like my foundational nutrient stack for anyone listening. And then obviously we can throw some zinc in there as well, 30 to 50 milligrams of elemental zinc per day. Yep. Yeah, people talk about a vaccine coming. I mean, we've had two other coronaviruses in 2002 and 2003. We had the SARS coronavirus, and in 2015 we had the MERS. So there's been a lot of time that's passed, and we still don't have a vaccine. So people forget that. So the fact that we don't have a vaccine for other coronaviruses, odds are there probably won't be one for this. And also, we don't have even a vaccine for HIV. So I'm not aware of any vaccine for an RNA-based virus. So people can correct me in the description. I'm not aware of any vaccine that is available for an RNA-based virus. So the odds are, looking at past history, there probably won't be one this time around. But I could be wrong, right? I know they're doing different types of vaccines that are more like protein. They're like taking a specific protein in the virus, and they're trying to make a vaccine that targets that protein, but not necessarily attack the virus. So they're doing different things. I think what's really interesting is because if you have a lot of people that have antibodies, let's go do platelet therapy. Let's go spin out the platelets, do a blood transfusion, take the antibodies out of the platelets, and then give them the antibodies in an IV. I mean, I think that's just a common sense first line therapy, along with all of the nutrients, right, that we talked about. And then maybe we play around with the hydroxychloroquine, azithromycin, and zinc protocol as well if we need. So I think we have some really good treatments, palliative acute treatments now, where maybe a vaccine isn't even necessary. If we can get things under control and get an adequate amount of herd immunity, it may be totally moot at that point once herd immunity is in place. Well, how did life go back to normal after the 1918 flu? I mean, like 3 million people died. Do you know in 1918, Woodrow Wilson didn't even shut down the economy? They just kept rolling. 3 million people died. How do we go back after that? We did it. How do we go back after 1 million people died in the Civil War? We did it. How do we go back to life after World War I and World War II and Vietnam? We did it. I mean, our country, United States, is a very resilient country. So I'm confident we can do it. And I think there'll be herd immunity in the background that will provide this extra buffer of support. We didn't even know about antibodies. I mean, they actually were doing some antibody, infusion back then in the 1918. They really didn't know what was going on. They didn't have the testing that we have now. So we are light years above and beyond a lot of this stuff. And I think I don't even think we had vitamin D supplementation back then. So we are so ahead of the game. I'm feeling really confident, and I'm ready for people to get back to work. Excellent, everyone. Great chatting with y'all. If you enjoy the podcast, put your comments down below. Really excited to know what you guys think, what you guys are doing, what's working for you clinically. We appreciate you spreading the word to family and friends. Sharing is caring. And if you want to write a review as well, evanbrand.com/iTunes, justinhealth.com/iTunes for a review. We really appreciate it, guys. You take care. Have a good one. Bye.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.